Good morning. I'm Pernell, Program Director for the Partners in Health and Wholeness Program with the North Carolina Council of Churches. My colleagues have been offering scripture, prayer, words of encouragement, and valuable self-care ideas, and some dad jokes each morning at 9 o'clock on Facebook. If you haven't checked them out, I would encourage you to do so. They're also on our website at ncchurches.org. I hope I can offer you something as well this morning. But since we're not in school and we're going into the weekend, I'm also going to ask you to do a small homework assignment. When I started at the council 4 years ago, I was very lucky to lean heavily on growing up a preacher's kid in Eastern Kentucky. I was also lucky to have a background in healthcare very early on in my career. It seemed like the perfect experience to help lead a program that focuses on bridging the gap between health, faith, and justice. Our team spends much of our time working directly with faith communities across North Carolina as they promote and help make a way for people to live healthier lives. During normal times, this includes hundreds of activities like partnering with local farmers to provide fresh local food, hosting all kinds of educational seminars and events, even some yoga classes and Zumba together. During times of crisis, like in the aftermath of the historic hurricanes that hit eastern North Carolina back to back, our work sharpens to focus on the most immediate needs of the day. Normally that includes access to food, financial resources, and the increased need for mental health care, especially around dealing with trauma. People's lives are impacted in devastating ways during the crisis, and it is then that I see most clearly the connection to faith and health, and when I see the church become the place that so many turn to for help. Then comes the coronavirus, a crisis unlike any we have seen in our lifetimes. In North Carolina, we have yet to see this peak, and we're already witnessing human tragedy that seems really kind of surreal. As of this morning, when I checked the numbers, as I've done every morning for a while, there are over 2,000 cases, 21 deaths, and job losses resulting in over 350,000 unemployment claims. This virus will leave few families untouched. And through this, I still see the church. Not the buildings, they're pretty much closed, but the people stepping in to fill the gap, delivering food, delivering medicine, holding online services, even if you've never done this before, and continuing to provide pastoral care and counseling. A church in Western North Carolina reached out to ask about a pattern for sewing masks for people in their community and for the many healthcare workers who are struggling to get what they need right now. It was really encouraging that we didn't even have to look really far to get 2 or 3 patterns because folks are jumping in and filling this need. My friend Michelle Mathis of Olive Branch Ministry in Gastonia, she often helps us with presentations about using harm reduction principles in another fight, the fight against overdose deaths. She often ends her presentations by reading the story of the resurrection of Lazarus. Most of you know the story, but it's worth another look. I had remembered that Jesus performed a miracle and raised his friend Lazarus from the dead. What I never paid attention to was what he said next to the others who were there. Unbind him and let him go. After hearing this from Michelle, I went back to reread that passage in John. I really come to like those powerful words. It's a call to action that doesn't require any of us to perform an actual miracle. That brings me to my homework ask. As people of faith, we know God can heal, but God also mandates that we act. It is our turn now to help unbind the oppressed. Our communities are being called on to act now. We know everyone is working hard to give as much of themselves as they can right now. And it is very difficult sometimes in this isolation period that we're experiencing, and it's so important. But even during this physical distancing, there's much that can still be done. There are resources on the council's website and many others that fit just about any ability level. I urge you to check them out and do as you're able. The one I would like to lift up is about faith and health. I ask that we all spend some time reading, asking questions, challenging long-held beliefs, and learning about the healthcare issues in North Carolina and in our nation. Talk to someone or several someones who are uninsured and listen to their story. The millions of people who are uninsured and underinsured, they already know that there's no real safety net out there. They know it isn't as simple as showing up at an ER. And with healthcare almost always tied to employment and employment skyrocketing, it's imperative that we stop for a minute and ask why we aren't doing a better job. As people of faith, we say that all are children of God. There are many that are wearing bindings today because they have no access to life-giving care. There are millions more that will soon join those numbers. And this virus makes it very clear that our health is really tied to each other. But we are also a people of hope, and we can make this a time of change. Become an advocate for healthcare policies that include all people. Find out what resources are already available in your community. If you're able, donate to them. And maybe later when you can, volunteer with the many safety net providers that are doing the best they can to hold things together. In this time, for sure, take time to take care of yourself, pay close attention to your physical and mental health, and do whatever you need to do to stay well through the coming months. And as you're able, please consider ways that you can help strengthen the healthcare safety net for everyone. Together, we have the power to unbind. Thank you.